Hi, Doctor.
Hi there.
Hi, good evening from Israel.
How are you doing?
Fine, thank you. How are you?
I'm doing good, thank you. Another crazy day here, but otherwise we're okay.
It's only the beginning of your day, no?
10 o'clock in the morning in here. No, my day started at 6 a.m., so about 4 hours.
So it's already crazy. Only 4 hours and it's already crazy. Hey, Rosie.
Crazy.
Beautiful Rosie.
Yeah, I gave her the looks, basically. She's not hearing us for some reason, I guess. Otherwise, she would
Trying to see the resemblance between you two.
Well, then I received some resemblance from her beauty, I guess, more than anything else. Well, it's great you guys have this group. So how long has it been established, the support group?
Okay. It's MS Home Association. Okay. This is like the main group. But because of the coronavirus, since last April, almost a year before, almost 1 year, we take all our offline activities and we did everything in the digital.
Right.
So we had like a small community, like 700 members, and now we have almost 2,200. Everybody are MS members. Nobody in the community is without MS. Okay. And they're talking to each other, and we have every week, like lectures, webinars, post like research, any detail, any new details that we can give them that can improve their life. And Rosie also can speak about what we are doing there, but in each month also we bring one of the biggest mentor in Israel. Professor Yoram Yovel is like for memory and cognition. Professor Rafi Carasso is for healthy lifestyle. He's in neurology, but he believes in also like acupuncture and shiatsu.
Good, that's good.
Yes. So next month is we have a mentor that she believes in sport and nutrition and also like healthy lifestyle, Michal Safir. So we do a lot of activities. And also the other thing that we did this year, also on behalf of the Corona, we have like a mentor program, and we have like 40 MS members that have like at least 5 year MS, they are sick with like at least like 5 years. This is the young member, 5 years, and they are going to be like a friend for the journey. The people that are going to get the diagnostic only this year.
Right.
And they are going to be their friend, and they are going to take them to a journey together, and we are like teaching them how to be a mentor.
Good, good. That's really important.
That's so really all kind of activities like this, and our community is getting bigger every week. Yeah. And the pharmaceutical companies are talking about it more and more, and they give us money. And because they give us money, we hope for more, yes, but because they give us money, we can bring any kind of lectures and any kind of different important people that they can speak to the community. Sure. We speak on the Zoom, and and then we shoot it to the Facebook, directly to the Facebook community. And in the Facebook, they ask questions, and then I read the chat, what is there. Sure. And this is how we do it in the last year.
I think that's a great thing you guys are doing over there. I mean, obviously in the US, we have like hundreds of support groups through National MS Society and other things. And I sit on the board of directors of National MS Society in the US. So I've been involved in education stuff for almost 20 years. So, but it's great that at least this is the patient driven. It came from you guys, and especially the mentorship program. I think it's really important because we established something like that at USC, University of Southern California, when I was there, because we wanted people who are seasoned MS patients who have been through it for like 10, 15 years to be able to mentor the young ones who are petrified. They don't know what's going to happen. They're very scared. So we used to hold support groups in our department at that time when we were able to. And of course, since then, they've been doing it more virtual also. But I think that's important because a lot of patients, when they get diagnosed, they have a lot of information coming to them, and some of them are good and some of them are bad. And they don't need a lot of false information. And it's good to have someone with them to separate those wrong information from the right one and tell them, you know what, no, you're not going to end up on a wheelchair in the next 5 years, for example, which is something a lot of MS patients think they might. But anyway, that's a good thing you guys are doing, and I'm happy to be here with you guys and help out.
Good. So I'm now going to broadcast to the Facebook, and then in 1 minute we will start.
Okay.
I will tell you when we are live. Okay, so we are live. Hi, awesome. Rosie.
Hello, Erev Tov, Mr. Daniel.
Erev Tov to you guys, and good morning in here to all of you.
You are now in California?
I am in California, yes.
Good. So let's start. Okay. Good evening, Doctor. It's my honor to host you in our MS community in Israel on behalf of the MS Home Association and also Irit Luzon, our CEO. And so, good evening, first of all.
Good evening.
And it's a great honor. It's a great honor to talk to you. I hope when my English will be that you will be satisfied with my English. Usually I used to speak in Hebrew, not in English, but I will do my best.
You're doing great.
And I have here beautiful Rosie Tuti Cohen, one of our members, and one of the biggest female and the strongest female that I met also. So Rosie, good evening to you too.
Erev Tov, good evening.
And after we have like a surprise between you and Rosie, so we'll talk about it like in the last chapter of our conversation. For now, everybody can be curious about it. So if it's okay, I will start with my first question. And before that, I would just like to introduce you to the community. So we have here Dr. Daniel Bandari, Director, Multiple Sclerosis Center in California and Research Group in Laguna Hills, that you have in the center more than 2,000 MS patients, a clinical assistant professor of neurology and neuroimmunology, more than 20 years of experience as a clinician and researcher in multiple sclerosis. So good evening.
Good evening to you.
And my first question will be, in the last couple of years, are there any breakthrough that you know of regarding new MS research that you know?
So the answer is yes. Let's put it this way. That's a short answer. The answer is yes, but it depends on what people want to call breakthrough. First of all, before I move on, Annette, do you want me to pause in the middle so you can translate in sentences, or do you want me to give the full answer?
We'll do it in English. I hope our community, hello to Sagit. Sagit now also. Hi, Sagit.
Hi, good afternoon.
Good afternoon to you as well. Okay, so if that's the case, then I don't need to pause then. You want me to just go ahead and give the answer?
Yes, but maybe because you are the only one from here, except also Sagit, that speak like fluent English, maybe you know a little less to hurry with the answers, so everybody in the on Facebook will understand us, because we are not going to translate every part.
Okay.
Good.
So the question that you asked was that, has there been any new breakthrough in the world of multiple sclerosis? And I have to say the short answer is yes, there has been. Almost on the annual basis, in the past probably 7 to 8 years at least, we have had at least 1 or 2 new medication has come out in the market for multiple sclerosis. Now, the big element is that most of these medications did not have a previous generation of the same drug. That means that for years, we were using interferons like a Copaxone or Betaseron or Avonex on the patient were injectable. And then the oral medications came out, such as Tecfidera and some of the other ones, which help. But the newer generation medications are what we call monoclonal antibodies. And these are the things such as Tysabri, such as Ocrevus. These are some of the medication that has been used in the medicine for other conditions, such as cancer treatment. But now we're finding some of these medications are to be very helpful in treating aggressive multiple sclerosis. So that's one aspect of it. The second breakthrough that we have discovered over the past probably 10 years or so is the fact that there are other elements beside medication that's going to play an important role in the quality of life of the MS patients. And you mentioned some of them in the past in our discussion, including quality of life, diet, exercise, all of those things. But probably the most exciting innovation that we have been able to work on, and it's still continuing in our center, is using molecules such as a stem cell transplant, for example, in treating disease such as multiple sclerosis. So that is probably one of the biggest breakthrough that has been. We are not still able to offer it to every human being because we're doing the animal study on it. But I have to say over the next probably 2 to 5 years, that kind of treatment using genetic medication and using a stem cell medication will be something that we're going to be seeing coming out into the MS treatments.
Do you see today more pharmaceutical companies working on more and more drugs, new drugs?
So again, the answer is yes and no. There have been, because I've been a researcher for MS for almost 20 years myself, and I've been involved in almost all the clinical trials that has gone around the country, I know there have been some companies who are still very committed doing clinical trial on MS. They reserve close to about 25% of their budget only on MS within neurology. And yet there have been few companies that sadly, even though they were doing research in MS, because they had a negative result, let's say on one medication and it didn't pan out to work, they had to stop MS trial. So all in all, I have to tell your audience that there is no worry. There are enough pharmaceutical companies in the world that are doing research right now, and they're going to continue investing in multiple sclerosis. So we're not in shorthand. Okay?
How did you get to do your 20 years of research about MS?
Why? Because are you so young and handsome? Is that what you're saying? Why am I so young?
Of course.
Well, no, I'm joking. I'm joking. So becoming an MS doctor was something that came to me after I had already been in medical school. So one of the key things was that when I decided to be a doctor, I was about 12 years old at that time. And then at that time, I wanted to be a cardiologist, actually, not a neurologist. And then when I was in medical school, one of my professors, who was a great guy at UCLA, he said, you know what, you have a brain of a neurologist, not a cardiologist. And he challenged me to do a research with him. And at the end of that research, I was so fond of neurology that I decided to become a neurologist. But why did I become an MS doctor? Because my background, when I was in college before medical school, I have a degree in immunology and neuroimmunology. So, and also the MS patients, I found them to be the most intriguing patients. Why? Because they're young, they're active, they participate in their medication management and what they do compared to some of the other neurology. I always enjoyed treating MS. So that's why I did a special training for 2 years at USC afterward. And I did a fellowship in MS and neuroimmunology and became an MS doctor. But then again, I found out later on that there were a higher purpose to that also, which I'm sure we'll discuss later on.
What do you know from your research about the stress factor and how it influences MS chronic disease?
Very good question. So I personally believe stress and anxiety and depression and psychological effect can play a very important role, not only in the progression of the disease, but we believe today that quite a lot of patients, the ignition of MS, the way the MS started it, sometimes was related to the fact that they went through a stressful situation in their life. And when I ask a lot of my patients, was there any particular scenario? Could have been death in the family, loss of the loved one, getting divorced, or some sort of a stressful event that ignited the whole process. And I have to tell you, when you go back and think about medical aspect of it, of the stress. So studies have shown, immunologically speaking, when you are under a lot of stress, you produce certain negative neurotransmitters in your body, such as dopamine and serotonin, because that's how anxiety basically get built up. And at the same time, you also increase the concentration of your white blood cells and immune cells. And as you all know, MS is an autoimmune disease that's overactivated B cells and T cells are what attacking the myelin. So during those circumstances, it's like developing a perfect storm that you have a high concentration of the stress, high concentration of the white blood cells in somebody who has been susceptible to have the disease, of course. And then that ignites the first symptoms, which could be anything like vision problem, optic neuritis, weakness, numbness. So stress not only plays a role in the start of the disease, but at the same time, throughout the disease, we know specifically having a stressful life, both at home and work, or a stressful condition has always shown exacerbation in MS. A lot of MS exacerbation comes when the patients are through stressful circumstances too. So we always put that into consideration. One of the things that I have done over years as an MS doctor is that whenever I diagnose a patient, a new patient with MS, I'll always evaluate their state of psyche, psychological state. I want to know whether they have proper support and coping mechanisms in life. Do they have somebody good at home? Is their husband supportive? Is their wife supportive? And if they do, that person is going to be very beneficial in their overall treatment. And if they don't, a lot of times do they need to be under care of a good psychiatrist or psychologist, to develop, like a therapist, to develop a coping mechanism. And one of the other things that we have implemented, including some of the other psychotherapy treatment, including NLPs and some of the psychotherapies and some of the other things that we have actually introduced to the patient, has been very helpful to be able to alleviate some of the stress and anxiety in them. So there are a lot of things can be done for it.
What can you recommend us, because we live in Israel, which is a stressful country. Stress is all over here in Israel. It's in the media, it's with the corona, it's all over. What can we do when we live in a country like Israel?
So I absolutely agree. Obviously, having been in Israel multiple times, you know, before the COVID, almost on the annual basis, I would go and visit and lecture and all of those things. I completely understand the stress of the environment that you guys live in. Not only including the fact that you're surrounded with, you know, missiles coming flying over your heads and all the terrorism activities and bombing and all of these things, which is by itself, in my opinion, extremely stressful. But at the same time, there are multiple elements of stressful life, being able to survive in the environment of the COVID, for example, needing to follow certain regulation. All of those are important. The advice that I give to my patient, because in here also, even though obviously on a daily basis, we don't have missiles flying over our head, but there are internal missiles that go through from family to family, people losing their jobs, people having issues with multiple other aspects of their life. Developing a good coping mechanism starts with the patient sitting back and looking at their lives, and they see what are some of the different subparts of the life that are good and what portion of them are increasing anxiety and stress in them. I have had patients who have come to me and they said, you know, I'm really good. I'm exercising. I'm taking my medication. I'm meditating, because meditation, of course, is something that can really help a lot of patients. But whenever I walk into my office, I can feel some of my MS symptoms comes on. I get numbness. I get tingling when I'm stressed at the office. And the funny thing is that during the COVID, a lot of these patients, they start working from home. They didn't have to go into the stress environment. And now when I talk to them, because that the stressor is gone, they're doing much better. They're still able to function at their work, but that enigma of the work environment that was giving them anxiety has gone away. My main point being is whatever it is that you believe increases anxiety and stress in you, whether that's a work environment, whether there is having a very negative family member who's just keep yapping and giving a negative thoughts to your head, whether that is you don't have enough time for yourself to exercise, to meditate, to enjoy life. Even being able to have some family gathering, for example, has been a stressful factor right now because of COVID. People cannot get together and enjoy social life. Being able to get back to normal. And that is one of the key things that I believe, especially now, during the past year of pandemic, a lot more MS patients, obviously from one hand, they benefited from the lack of the stress of not working at work or some of the other thing. But the other aspect of it is there have been increasing stress because of the unknown part of this pandemic. Should I get vaccinated or not get vaccinated, which I'm sure is a topic that we're going to discuss later on. I'm not going to be able to go out and socialize. We're cooped up at home, most of us. And as human beings, we are organisms, we're animals that need to be out, need to enjoy traveling, vacationing, eating, enjoying family, friends. We're not having those. So we got to understand we have developed a different coping mechanism to deal with that kind of thing. And I believe if we sit back and again, as I said at the beginning, take a look at ourselves and our life and pick those two stress factors in our life and try to eliminate them is going to make a big difference.
Thank you. What do you think about the importance of nutrition? And Sagit, that is with her, she is a nutrition also. So Sagit, if you will have more questions about this subject, please do, feel free. But what do you know today from the last years that with nutrition, you can help MS, or you can, live more like a healthy lifestyle, or what is the importance of nutrition today?
That's an extremely important topic, actually. So one of our biggest discussion, again, in our MS centers with the patient is not only surrounding medication, but surrounding nutrition factors. We actually did studies at USC looking at different diets. Because as you all know that if you go to Amazon and type nutrition books for MS, you're going to get probably about 100 books written by people who don't even have MS, but they just want to make money out of selling books for MS. And not every one of them, in my opinion, because I've read almost every one of them, and I don't think some of them are beneficial. As a matter of fact, I believe some of diets that have been recommended could be harmful to MS. So the way we look at diets are from two aspects. One is the amount of the proper nutrition and calorie intake that you have. And the two is that, are you having more what we call pro-inflammatory diet, or you have anti-inflammatory diet? And what do I mean by that is that there have been certain kind of food which have been related that can increase inflammation in the body. Red meat is one of those, for example, that has been reported. Fried food, too much alcohol. These are being three main food or dietary components that can increase pro-inflammatory cytokines, or what we call increased white blood cells in the body. And as we talked, MS is an autoimmune disease. You really do not need to overboost your immune system, unlike some people think, because over-inflammatory in the body can increase MS attack, MS relapses. Fatigue has been directly related to the type of diet. So over years, the studies looking at different diet. We looked at Dr. Wall's diet, which I'm sure a lot of people have read about it. We look at Atkins diets. We look at this diet, that diet. And we found out none of them by themselves were helpful. In my humble opinion, the best diet that I recommend to the patients in the clinic, what I call modified cardiovascular / Mediterranean diet. Why is that important? Because when you're looking at cardiovascular diet, and that's basically the limitation of the amount of the fatty food that you take. Low red meat, mild to moderate chicken, mostly fish, because it has the highest level of the amino acid, but lowest level of fat. Fresh fruits and vegetables, nuts, proper hydration, reduction of the alcohol consumption, reduction of the sugar and carbohydrates. So that's a cardiovascular diet. With a Mediterranean diet combination, you have more fresh product into your diet rather than cooked. Fresh fruits and vegetable has been shown to have the highest level of the vitamin that it comes. And I don't know how it is in Israel, but in the United States, for some reason, culturally, they're not used to eating a lot of fruits. Fruit is something that some people do, but in the Middle Eastern culture, Israeli culture, we always ate food. We always had fruits in our homes. And when patients start having fresh fruits, for example, fresh grapes, apple, all of those things, not only are they getting antioxidants in their body, which is important for anti-cancer, anti-cardiovascular issue, but immunologically, it also helps their immune system. So one aspect of it is having that modified diet that can help them. But that by itself is not only important because, again, supplements such as vitamin as a part of the diet is very important. And one of the other things that unfortunately people have taken advantage of MS patients throughout the world, and they've been selling them certain vitamins that is going to help MS and it doesn't. And some MS patients have spent thousands and thousands of dollars on shekels buying vitamins, which in my opinion is not necessary. It is a bad thing because people take advantage of people who are in a desperation. And sometimes MS patients, they go to the vitamin store and tell the clerk, which one of these helps MS? And the clerk who receives commission by selling those vitamins tells them all of those. So they spend a lot of money. We believe having 5 main vitamins in the body as a supplement, taking as a supplements, are the most important. 1 is a multivitamin a day. 2 is omega-3 fish oil. 3 is vitamin D3, D as David or Daniel, vitamin D3. The third one, or the fourth one, is being B complex, B as a boy complex. And every once in a while, I recommend some of my patients to start having some like turmeric tablets that has been shown to reduce the inflammation in the body as a supplement. But there are certain vitamins that are actually harmful to MS, such as if you take kava, ginseng, coenzyme Q10, for example, for years people thought is helpful in MS. It's not really helping. So reducing concentration of bad vitamins and bad food and moderating the diet to something which is healthy and balanced. I had a patient whose main diet, believe it or not, was a steak and potato. Like on a daily basis, this guy was from Texas, and on a daily basis, his lunch and dinner was a steak and potato, which means he's getting a lot of carbohydrates, which is not really good, and he's getting a lot of red meat, which is horrible. And he was having a lot of fatigue, because one of the key things happens when you're having this inflammatory food, the concentration of the energy producing enzyme in your body goes down and people get fatigue. And not only physical fatigue, they get mental fatigue, that the mental sharpness goes away. I put him on a particular diet. I said, for 2 months, you're gonna have a steak only once a week. And the other days, you're gonna have fish, chicken, and vegetables. By 2 months, we measured his cognitive function because we do neuropsychological testing and cognitive evaluation in our clinic. We have the computer base that we can do. His cognitive function improved. His fatigue scale improved tremendously. And he was feeling much better. And even his immunology was better. So to your point, diet is extremely important.
And what
Matt, don't you think we should translate this part? I think it's very important.
To translate it to Hebrew?
About the diet and the pills, the vitamins. I think you should, or Sagit, or you, or me. I think this is the most biggest question of MS patients, what to eat and which vitamins to take. What do you think?
No problem.
I think we can translate it. Rosie, if you want, you can go ahead. But if I may ask, just to wrap up what you just said, you've mentioned, well, if I'm looking at healthy lifestyle, I mean, everything that a person with MS should do, other than being on on disease-modifying drugs, then you've mentioned stress reduction, and you've mentioned a coping mechanism when having a support system, and you've mentioned diet and supplements, and I think you've mentioned exercising.
Right.
Okay, and also you've mentioned meditating. Okay, anything that I've missed, or you think?
I believe that is probably, obviously the list can go on and on. I mean, Sagit, we wrote books on this kind of thing, and the complementary, we call it complementary aspect of MS, because that is separate than disease modifying therapy. When I say complementary, and that is important because you brought it up, so some MS patients cannot differentiate between complementary medicine versus alternative medicine. And again, I'm sure in Hebrew, you guys have translation of it, that it's really important for the patient to know. Complementary medicine does not replace the disease modifying therapy. You still need to be on your MS medication. And that is something that I have seen a lot on patients who don't understand the differentiation. And sometimes they come to the office and they say, well, I stopped my Tecfidera, for example, and instead I'm doing diet. Well, they're not mutually exclusive at all. And that I believe it's really important. So all of those 6 factors that you said, I think plays a very important role. One additional thing that I want to add to that, we talked about exercise, obviously, which is crucial in my opinion. Getting physical therapy, for example, aquatic therapy, pool therapy, those are also a big part of the exercise. But the other part of the exercise that I want to also make sure that it's added to that is the cognitive therapy, memory exercise. These are something that some people are not used to doing it. They're used to going to the gym, exercise their muscle, but people are not used to sitting down and reading books for using these computer programs that are memory games to improve memory. We have done an extensive study that showed it is extremely important to exercise your brain also. So I would just add that to the nice list that you put together.
Okay, and if we're talking about exercising, do you know if there's any specific recommendation about which type of exercise is like most recommended?
Right. So we consulted actually, because I have physical therapies and occupational therapists that we work with in our MS center as a comprehensive approach. And also I have consulted some other, physical medicine rehabilitation doctors and other people. We believe one of the best, it depends on the degree of disability on the patient to understand too. Like if somebody has issue with the legs and mobility and that kind of thing, it might be different. But in average MS patients, at minimum, and this is the minimum that we recommend to them, 3 days a week or 1 hour each day. And our recommendation has been of that hour, 30 minutes cardio, 30 minutes weight, and about 10 minutes of a stretching exercise to be done before and after. But at minimum, what I mandate my patients to do is 1 hour a day for 3 days a week. Now, there are patients who exercise every day and they feel much great and much better, and there are patients who don't. So the type of exercises, anything from obviously being able to use equipment, treadmill, elliptical, bicycles, those are the stationary bike, those are the things that can really help upper and lower body. But doing a little bit of weight also is very important, because there are patients that I have who just spend the time in the cardio exercises. That is good, but for MS, in order to not cause muscle weakness, you need to exercise some weight in your muscles as well. And that's why I recommend spending half of their time doing weight. And that weight doesn't have to be using extreme 50, 70 kilogram and lifting up. No, we don't want you to be bodybuilder, but you want to do enough to maintain the tone of the muscles. And at the same time, there are patients of mine who separately enjoys doing, yoga, Tai Chi, Pilates. These are some of the other things that can really help them as well.
Okay. Thank you very much.
Sure, my pleasure.
Regarding the nutrition, what about gluten and eggs and dairy products? Because these are questions that I know members of the community usually ask about nutrition. Also, what do you know today about this?
So let's put it this way. There are a lot of misinformation, wrong information out there about those things. So gluten-free diet, for example, was something that was brought up because there were a lot of people who had celiac disease, which is a gluten sensitivity issue. They had some inflammatory issues when they would take gluten. But I gotta tell you, for one MS patient that I have who had gluten sensitivity, I have about 900 of them that they don't. So that is not a common denominator among MS patients. So I do not recommend absolute zero gluten-free diet because we don't believe that would help. We do not also recommend absolute zero dairy because again, there have been articles that have published that dairy could cause inflammation and this and that. Yes, if your entire diet consists of milk and cheese and I remember when I was a kid in Israel, one of my favorite yogurt was a brand called Teshachus, something like that. And we used to have a lot of that. I don't know whether they still make it or not. So those
We still have it.
So that's a good childhood memory. So those are the good things to have because you need to have certain dairy in your diet for balance. Now, only people who actually been diagnosed with gluten sensitivity, which there are tests they can do, should avoid gluten. People who have been tested by a physician and have been told you are lactose intolerant, those are the ones that should avoid dairy. Eggs, for example, in my opinion, it's the biggest misnomer of all of them because actually having 1 or 2 eggs from the dietary standpoint has been shown to be very beneficial of getting proper level of protein in your body. Now, there are people who are egg sensitive. That's a different story. Those are the ones that cannot even get a vaccine with the eggs in it because they get allergies to that. Generally speaking, for average MS patient who's healthy otherwise, none of these 3 things should be absolutely eliminated. I do recommend absolutely reducing gluten and carbohydrates, but not to eliminate it from your diet. Because a big portion, and one of the biggest problems MS patients also complain about, is the gastrointestinal issues. A A lot of MS patients have alteration of diarrhea and constipation because the GI tract gets affected by the lesions in the spinal cord sometimes of MS. And some of them, they get chronic, for example, constipation. Eliminating portion of the fiber, which comes from the carbohydrate, is not a good thing. You need that in order to regulate the fiber in the body. But unless they've been diagnosed by their primary care doctor, somebody with one of those sensitivity, I do not recommend eliminating them completely from diet.
Anat?
Yes.
Rosie suggested that we will translate the part on the diet. Do you want to do it now, or do you want to do it afterwards? Do you not want not to do it at all?
Doctor, if it's okay that we will do a couple of minutes in Hebrew for the audience?
Okay.
יאללה, בוא נדבר עברית.
No problem. No, not me. Unfortunately, I'm not talented enough to do that at this point, but you guys are, by all means. Please go ahead.
Good. אז שגית, מי לוקחת את המושכות?
שגית, תתחילי.
אוקיי, אני אעשה סיכום קצר של כמה דקות כדי לאפשר לרופא להמשיך. מה שדוקטור בנדרי אמר באופן כללי, זה שהוא קודם כל עשה, היו פה שתי שאלות עיקריות, אחת על המרכיבים של אורח חיים בריא, אוקיי? ושאלה שנייה שהוא ענה ברחבה על תזונה. לגבי אורח חיים בריא, הוא אומר קודם כל לעשות את ההבחנה בין רפואה משלימה לרפואה אלטרנטיבית, מה שמשמעותי זה רפואה משלימה ולא אלטרנטיבית, זאת אומרת אין כאן אלטרנטיבה, כאילו תזונה ואורח חיים בריא ומדיטציה ופעילות גופנית וכולי, שתכף נדבר עליהם, הם מאוד משמעותיים, אבל הם לא מחליפים את התרופות. זאת אומרת, אם מה שנוירולוג ממליץ זה טקפידרה או טייסאברי או whatever, אז זה מצוין, ובמקביל צריך לעשות דברים אחרים. מה שמשמעותי בתוך הרפואה המשלימה, זה הוא מנה תזונה, תוספים, פעילות גופנית, מדיטציה, הפחתת סטרס, וגם מנגנוני תמיכה. זאת אומרת, אנשים שיש להם מנגנוני תמיכה במשפחה, חברים וכולי, הם אנשים שיכולת ההתמודדות שלהם יותר טובה, ואם זה לא קיים, הוא ממליץ להיות בקשר קבוע עם פסיכולוג או פסיכיאטר. הייתה שאלה על פעילות גופנית, איזה פעילות גופנית ממליץ. ההמלצה שלו הייתה 3 פעמים בשבוע, שעה בכל פעם, כמובן יותר זה יותר טוב, אבל לפחות זה. כשהשעה הזאת מחולקת חצי ממנה להתאמנות לספורט אירובי, אופניים, הליכון, הליכה, ריצה וכולי, בחצי השני לתרגילי כוח, כי הוא אומר שבגלל שבאמס יש סכנה לאובדן כוח שריר, חשוב לאמן את השרירים, אז גם זה חשוב. כמובן שמי שרוצה להוסיף יוגה, טאי צ'י וכולי, זה מבורך. בקשר לשאלה על התזונה, עונה ברחבה, אני רק אגיד בתמציתיות כדי להשאיר לו עוד זמן לדבר, הוא אמר שמה שחשוב זה תזונה שהיא אנטי-דירקטית, הרבה פירות, הרבה ירקות, הוא ממליץ, כמו כל הרופאים ברפואה קונבנציונלית, לאכול מעט בשר אדום, ולא להימנע באופן גורף מגלוטן, חלב וביצים. זה בראשי פרקים.
הוא גם מבקש להגיד שהמאכלים הפחות בריאים הם אלכוהול, מטוגן ובשר אדום, ולהכניס יותר דגים, ולגבי הוויטמינים, את רשמת אותם, זה היה D3, B קומפלקס. מה עוד?
מולטי ויטמין, הוא דיבר על מולטי ויטמין, הוא דיבר על ויטמין D, הוא דיבר על ה-B קומפלקס, הוא דיבר על אומגה 3,
מחוננת, ענת.
היה עוד אחד, רגע,
What's the last one, Mr. Daniel?
I was checking your memories to see how.
Yeah, she's good.
Almost 5, 4 out of 5.
So one of the other one was B complex, B as a boy complex, and the last one was another supplement. It's a supplement, it's not a vitamin, turmeric. Okay, so yeah, which we basically cook with it. You cook with it. There's a supplemental capsule that you can get from that, which has been shown to reduce inflammation.
It's very common in Israel. It's very common in Israel.
Okay, yeah.
What about pomegranate? We have research in Israel about pomegranate for the memory.
Yes, there have been actually some studies that people are doing right now, looking at the enzyme, which is pomegranate, which is diphenhydramine, to see whether the dry pomegranate capsules can help that also. And, you know, I love pomegranate, so I would recommend having it regardless of whether it's for memory or not. But I'm sure our ancestors, our grandparents who loved pomegranate and they stayed sharp for years, they had something to say about it. So yeah, I believe that that can be beneficial.
עוד דבר אחד, דרך אגב, שהוא אמר, just one thing that I forgot, כששאלנו על פעילות גופנית, אז הוא שם דגש לא רק על פעילות גופנית, אלא גם על אימון קוגניטיבי. זאת אומרת, לא רק לאמן את השרירים, אלא גם לאמן את המוח. לקרוא ספרים, ללמוד דברים חדשים, לעשות כל מיני אימונים מול מחשב, כל מיני תרגילים שמחזקים את הפעילות המוחית.
בנוסף לזה אני מוסיפה עוד שני דברים. קודם כל, לגבי הרפואה, כלומר, מה קורה עם התרופה המיוחדת כבר לגמור עם הסיפור הזה שנקרא טרשת נפוצה, אז עובדים בכל הכוח, יש כאלה, יש חברות תרופות שבאמת עצרו את זה, אבל רוב החברות ממשיכים בכל הכוח, יש להם מטרה, שנהיה בריאים תכף ומיד. זה אחד, ושתיים, הוא אומר שכשמישהו מגיע אליו עם אבחון של טרשת נפוצה, וזה אפרופו ענת ורוזי, זה המקור, ה-NLP, הוא יושב ושואל אם היה איזשהו טריגר שהפעיל את כל זה, ובדרך כלל זה יושב על איזשהו משהו. אז כמו שאמר, שגית, לא לקחת את הדיאט ואת הזה ולהניח את התרופה, ואני אומרת מנגד, תבדקו מה השורש של הבעיה ותטפלו בשורש הרגשי שהפעיל את הטרשת.
נכון, הוא אמר שזה טריגר של חרדה, של טראומה, של משהו מהעבר, שבעצם הוציא החוצה את האמת.
בדיוק.
מעולה. דוקטור, we'll continue in English. Thank you, Sagit. Thank you, Rosie. Doctor, let's talk about more about memory and cognition. You started to give us also recommendation. So what to do? But what do we know to do from the last research about the symptoms of memory and cognition regarding MS patients? And what are your recommendation for everyday basis that we can do at home these days to improve it?
Right. So one of the key things that we have discovered is that almost every MS patient at some point, they will have a little bit of the cognitive and memory issues. It may not be to the point that they are demented, like, having similar to Alzheimer can. First of all, one misnomer that some MS patients have is that they think because they have MS later on in life and because they get memory problem, they also have Alzheimer's disease, which is not true. Alzheimer and MS are completely two different things. Some MS patients in the latest stages, they can have memory problem, but it's just what we call dementia, which is memory issue, but it's not Alzheimer, and that's different. But looking at from the early stages, we found out that about approximately 26 to 28% of MS patients at some point complain of some memory issues. If you divide memory issues to primary reason versus secondary reasons, the primary reason being brain of the MS patients obviously not only has lesions in it, but brain of the MS patients can go through what is called shrinkage or brain atrophy. That atrophy of the brain, which we all go through it, regardless of MS or not, is been expedited in MS patients. The speed is a little faster. So for that reason, we got to do even more to recover from that. And what we do in order to recover from the shrinkage of the brain is to, number one, do everything that we talked about, but mainly be on the right MS medication. And the other thing you can do is proper diet and all the other thing. Provide yourself with the memory training exercises. So same as what we talked about using treadmill, bicycle, elliptical for physical exercise, there are certain exercises that we have found to be extremely beneficial in memory. Something as basic as reading a book without pictures in it. Because people love to read magazine and they just look at the pictures, and that doesn't enhance memory, that doesn't make memory better. But reading books or reading newspapers and being able to, after reading an article in a newspaper, to put it aside and think and see how much of it you remember. That's the memory testing that you do. If you're able to remember at least 50% of what you read, and you can tell someone what you read, that's a very good sign. If you cannot recall that, that means there are some memory issues, which means that you have to do certain exercises. One of the most basic exercises that can help on the daily activities is to make a list of the things you need to do. So let's say this morning you decided that, or tomorrow morning, because it's already late at night for you guys, tomorrow morning you say, I have 12 things I need to do today. I need to go drop off the kids. I need to go to the bank. I need to go to grocery shopping. I need to do, so you put 12 things. Tonight, write the list of those 12 items down for you and read it. Go to sleep. Tomorrow morning, get up and read that 12 items list and have the list with you. And as you're going through doing one job, read that list. I can promise you, after the second or the third one, you don't need to read the list anymore because you remember all of those that you need to do. My point being repetition. Repetition is a topic that brain likes because the more feedback you give to the brain, the more retain information. Now, one of the other things that we used to recommend to some of our patients to remember things was that to use sticky notes, you know, the sticky notes that you use with a stick, and write the important things that you need to do on one or two of them and stick them to some of the places that you visit the most in the house. What are the two places in the house that as human beings we visit the most? One, refrigerator door, because we go to the refrigerator multiple times a day. So you put a sticky note on it and you see it. Number two, mirror, bathroom mirror actually, yes. So the bathroom mirror and refrigerator door, you put a sticky note on it and you look at it, a few times you see it, I have a doctor's appointment tomorrow. I have a doctor's appointment tomorrow, and you're not gonna forget it. And eventually your brain gets a habit of learning these things. So number one, repetition, reading, and be able to recall information. Number two, there are memory enhancing games that are available, such as crossword puzzles that we get to do. Crossword puzzles are extremely helpful because you not only have to think about the answer, you have to think about the ratio of the number of the letters you need to put in there. And that makes a very important thing. There's a game in here that is published in the newspaper. It's called Sudoku, which is also another kind of memory enhancement. Third, there are websites that provide memory enhancing games to you. One of them is called Lumosity.com. Lumosity is spelled Lumicty, like luminosity, which is the light. Lumosity.com is a website which is available throughout the world. I think they have to pay like $5, $6 a month or something, but it gives memory enhancement game, and you start from the low and you go up on that. There's another website called Elevate.com, you know, like elevator, Elevate.com. Similarly, it provides memory games. They're entertaining, but at the same time, it trains your brain to remember things. And lastly, there are patients whose memory and cognition is really declining to the point that they need professional help. Within the realm of psychology, there are specialists who are called cognitive rehabilitation therapists. These are the people that work with not only MS patients, but with the Alzheimer patient, Parkinson patients who have memory issues. And you know what? They have tools that can help people who have a very severe cognitive issues. So that's one aspect of memory, which I think it's important to be evaluated and treated. But one other thing that is really important, not everybody who has a memory or seems like they have memory problems, they actually have a cognition problem. People, when they are depressed, for example, they don't have a proper memory. They can't remember things when you're in the depth of depression or anxiety. So there is a concept in medicine which we call pseudo-dementia. Pseudo means false, dementia being memory problem. So we call it pseudo-dementia. When somebody's extremely depressed, they don't care about remembering things because the last thing in their mind is that I don't care if I need to remember that or not because I'm not going to go to my appointment. I'm not going to go to visit my family. I don't need to remember things. In those cases, treating the depression and anxiety is what's going to help memory to come back. But aside from that, MS patients with memory issues, those things that we talked about very basically and briefly, they can help them.
Anat, can I ask a question, please?
Of course.
Okay, Mr. Daniel, I have a question because patients that come to my clinic for treatment that have MS, I don't know if it's something in Israel or something in the world, there is a book they get when they get the result that they have MS that shows the level of like the MS going bad. And is that something in America also? Because this is something I want to talk about and explain from you as a doctor, as a specialist, that really seriously, everybody can handle their MS and no doctor ever can really know what will happen with MS, but you, if it's handled by your mind and your body. And then we will talk about the other subjects, like how we met in the MS area, and we can show that.
Okay, we can talk about it.
What?
I said, I'm sorry, I don't know who you are, but that's okay.
I know, I don't know who you are too, but maybe we'll find an...
let's go back, talk about the very important thing that you brought up, Rosie, and that is the fact that every MS booklet on every MS medication or diagnosis of MS always put a graph on it, which is a declining graph of declining physical ability, declining cognitive ability. And it talks about the progression of MS, that patients go from relapsing MS to secondary progressive MS, to more advanced MS. But you gotta understand, and this is something you may want to translate to your audience.
Yes, we will.
Is the fact that there is no predictability in MS whatsoever. We do not have a crystal ball. There is no blood test. There's no spinal fluid. There's no imaging that can give us the ultimate how your MS is going to be later on down the line in 10, 15 years. Having said that, there have been some studies that allow us to be able to tell you in the next couple of years, if you take your medication, if you do your exercises, what good direction you're going to go, or how bad direction you're going to go for the short term. But in the long run, there's no predictability. So having said that, it's really important to have a positive attitude about it. One of the statements that I have told every MS patients when I diagnose them, on the day that I sit in front of them and I tell them, Joanne, I'm sorry, we've done all the tests and you have MS. The next statement that I have made over the past 22 years is that, but you gotta understand, MS is not a cancer. MS is not gonna kill you. MS is not gonna do anything to you unless you let it. And that is a fact, because one of the key important elements about MS is your attitude, your behavior, your knowledge, and having the right knowledge is what's going to drive this, okay? There have been a lot of MS patients who, from the get-go, off the bat, they gave up everything. So because I have MS, I'm not going to do anything. Those were the one, obviously, that they decline very quickly, and obviously, they get disabled as a result of MS. And at the same time, there are more percentage of the MS patients that they are positive about that. You should always, in my humble opinion as a MS doctor, you should look at this disease as an opportunity, in a sense that this opportunity has been given, again, rather than sitting down and saying, why? Why do I have MS? Why did I get it? Because we don't know. There are thousands of reasons for people to get MS, genetic, environment, multiple other factors that comes into the picture that we don't really understand. Viral diseases that we had as a kid, immunology. But regardless of pondering for years and years and years, why did I get MS? Why was
change it to what? What can I do
to come out of this thing and be positive?
Yes.
So I believe one of the key factor of it is personality, developing that chutzpah and it that allow you to be able to continue living a normal life. And that is the key factor. People come and tell me, Dr. Banderi, when is the cure coming out for MS? And I tell them the cure is here today. We just don't see it. And what is a cure? If I can control your MS from having relapses, if you are able to live a normal life, get married, get pregnant, have as many kids as you want to, see your children, grandchildren, great-grandchildren, go to college, go to university, go to military, whatever you want to do, and live a normal life. That's a cure. Yeah, we don't have that injection that I can give you to eradicate all the white spots from your brain. But the cure of the MS, in my opinion, is when we are able to live as normal as a life as we can. I have patients in here who have had disease for 35 years and they are wheelchair bound. Literally, their leg have lost functionality. And the personality of this patient is so refreshing because when somebody talks to them and says, you haven't been able to walk for 20 years, how do you feel? I said, I have this electric wheelchair. It takes me everywhere I want. I'm still alive. I'm enjoying my life. I'm traveling anywhere I want to go in the world. I use wheelchair. No, I'm happy that I'm still here. So it's the concept of looking at a glass half empty or looking at a glass half full. And they always said, the reality of it is that it doesn't matter whether it's a half empty or half full. I think we should be thankful that there's some water in it, in that glass. And that's all probably matters more than anything.
So to be optimistic and to be with positive thinking is like the most important drugs.
Can we translate this? I think this is the most important question in this interview. This is what I think, because people go to the doctor and get this book, and this is what they see all their life. זה בסדר שאני אתרגם? Is it okay I translate it?
בטח, בטח. ונתרגם גם משהו על הזיכרון אחר כך.
השאלה שלי הייתה, אני שמעתי מכמה וכמה מטופלים שמגיעים אליי לקליניקה עם MS, שיש איזשהו פרוספקט שהם מקבלים מאיזה שהם רופאים, או איזושהי נבואה על אם הרגל שלי קצת אני לא מרגישה טוב, או קשה לי עם הרגל, אז זה הולך לעבור לרגל. אז אנחנו פה להגיד, קודם כל כמישהי שחובה MS וה-MRI'ים שלי משתפרים מפעם לפעם, חברים, זה הכל בראש, לא מתים MS, השליטה היא בידיים שלנו, החיים שלנו בידיים שלנו, וזה עובד על המיינד, איך אנחנו לוקחים את זה. כמו שדניאל, דוקטור דניאל אומר, האם אני מסתכל על החצי כוס הריקה, או האם אני מסתכל על המלאה, ומה זה משנה בכלל? בואו ניקח את המקרה הקיצון, וזה הקיצון, זה לא עומד לקרות לאף אחד, כי זה הבחירה שלנו. גם בן אדם שמגיע למצב הכי קשה, הוא חי, הוא מביא ילדים, הוא רואה את הילדים, נינים, נכדים, וחי את חייו ועובד. וזה ההסתכלות, וזה הראייה. זו מחלה שחיים איתה, היא חלק מאיתנו, והיא בסדר. בבקשה, ענת.
אני רוצה רק ככה לחזור על מה שהוא אמר כששאלנו אותו לנושא של זיכרון וקוגניציה, אז מה שהוא אומר היום בעצם זה שיש הרבה תרגילים לשיפור הזיכרון והקוגניציה. שיפור הזיכרון, קודם כל מחקרים מראים שפעילות גופנית באשר היא, אוטומטית משפרת את הזיכרון, זה כבר מחקרים שקיימים ויודעים. מאוד חשוב ביום יום לקרוא ספר בלי תמונות, לקרוא עיתונים, לקרוא מאמרים, לשים רגע את המאמר או את העיתון בצד, לנסות להיזכר לפחות ב-50% ממה שקראתם, לספר את זה למישהו, זה איזשהו מבחן עצמי. אם הצלחתם לספר 50% ממה שקראתם למישהו, אז הזיכרון שלכם בסדר. אם לא, אז יש איזשהו בעיות שצריך לעבוד עליהן קצת יותר ולשפר אותם, סוג של מבחן עצמי. לעשות רשימה, למשל, של 12 הדברים שאני צריכה לעשות היום, סוג של צ'קליסט, על בסיס יומי, לקרוא את הרשימה לפני השינה, לקרוא את הרשימה בבוקר, אחרי לפחות פעמיים שאנחנו קוראים את הרשימה, המוח יתחיל בעצם להתכוונן ולזכור את הרשימה, ולזכור דברים מתוך הרשימה ויעשה את ההשלמות, אנחנו מחדדים את הזיכרון. עוד מה שהוא אמר שחוזר על עצמו זה נושא של רפטיציה, רפטישן, כמה שיותר המוח מאוד אוהב את הרפטיציה, לחזור שוב ושוב ושוב על אותה פעולה, ואז הוא מפתח הרגל, ואז הוא זוכר יותר ויותר את הדברים האלה. הוא המליץ מאוד להשתמש בסטיקי נוטס, הפתקים הצהובים או צבע אחר עם הדבק מהצד השני, לקחת 2 פתקים, לכתוב עליהם 2 דברים חשובים שאני צריכה היום לעשות, כמו תור לרופא או משהו שאני צריכה לקחת את הילד, לשים את הפתקים ב2 מקומות מאוד מאוד בולטים בבית, למשל על המקרר, כי אנחנו פותחים, סוגרים, סוגרים, פותחים במהלך היום, ולמשל המראה בחדר אמבטיה, שאנחנו שם מצחצחים שיניים, או לוקחים תרופה, או כדור, או רגע מסתרקים, אז משהו שם במראה של האמבטיה, ולקרוא מה כתוב על הפתקים, ולאט לאט עוד פעם המוח ככה מתחדד וזה משפר. משחקים, תשחצים, שאלות, סודוקו, מספרים, כל המשחקים האלה זה משחקים ככה שעובדים ומחדדים. 2 אתרים שהוא ממליץ עליהם זה Lumosity וגם elevate.com, 2 אתרים בחו"ל, יש גם אתרים ישראלים שאפשר למצוא שיש בהם משחקים בעצם לזיכרון וקוגניציה, ועוד משהו שהוא ממליץ זה לעשות שיקום קוגניציה. הם מרגישים שהקוגניציה בעצם בחיי היום-יום הולכת וקצת יש איזושהי הידרדרות בעצם קוגניטיבית, אז לעשות שיקום, עובדים איתכם ביום יום על הדבר הזה, עשינו גם הרצאה על הנושא, מרפאות בעיסוק שעושות שיקום קוגניטיבי, מאוד מאוד חשוב ללכת, והדבר האחרון, לשים לב האם זה באמת בעיית זיכרון שקשורה או לא קשורה ל-MS, או קשורה למצב הנפשי שאנחנו נמצאים, כי גם בדיכאון, גם בדכדוך, בטח כשאנחנו אחרי שנת קורונה מלאה עם ריחוק חברתי בבית, אם אנחנו מרגישים סוג של דיכאון, גם הדיכאון לבד מייצר בעיית זיכרון ופוגע ומחליש את הזיכרון, ולא צריך לטפל בזיכרון בסיטואציות האלה, אלא ללכת ולטפל בדיכאון, ולשים לב כמה שיותר רפטיציה וכמה שיותר לתת למוח להתאמן, לעשות לו תרגילים. Doctor, we translate what you said about also the memory, the cognition, and the positive thinking, which was very, very also important. We talked about movement and sport. We talk about nutrition. We talk about memory and cognition, and also the stress factor. What is your generic belief or your belief about a healthy lifestyle? What is a healthy lifestyle? How is a week or a month in a MS patient should look like? How does he need to treat himself? What does he need to think about? You know, like your belief, your own belief.
So if we had another couple of hours that we could talk about just that part, obviously that probably would be important. But generally speaking, my personal belief, not just as a doctor, as a human being, is that we are able to achieve and accomplish whatever we put our mind into it. And again, we all have gone through a lot of obstacles in our life to get where we are today. Some of those obstacles could have prevented us from being here today easily and could have derailed us. But at the end of the day, I, as a doctor, believe my MS patients have the highest capability and drive to get wherever they want. So healthy lifestyle is a very subjective term, unfortunately. Why? Because from one person to another, healthy life is different. For somebody who's been a chronic smoker, for example, an alcohol drinker, healthy lifestyle for him could be just reducing the alcohol content and quit smoking. Versus for somebody else, quality of life means not only I'm exercising on a regular basis, I'm having a proper diet, I go to my doctor's appointment, I take care of myself, and I eat it proper, I acknowledge my mind. So in my opinion, whatever positive step a person can take, and that doesn't have to be everybody should follow that particular golden list that we talked about. As long as you're able to do on a monthly basis, do one additional steps into the things that you were not doing before. If you were not exercising, make a commitment to at least start with 1 day a week, not much, 1 day a week for 1 hour. Next week, 2 weeks after that, makes it 2 days a week, and gradually increase it to 3-4 days a week over next 2-3 months. Just give yourself that commitment. If you are not exercising your mind, for example, try to continue reading something at night, for example, which exercises your mind. Getting involved also is a part of quality of life, in my opinion. One of the things that we talked about before we started the program was the fact that how important it is for a mentorship program. We have done studies that have shown when a patient gets to the point that they're able to communicate and teach other people about something, they have reached that acclimate. As a professor of medical school, to us, it's obvious. We were all students at some point. But once we became good at one thing that we do and we can teach it to the other student, then you have reached a higher level. Same thing with MS. You guys are all, some of you are students, some of you could become a teacher to teach other people. So the combining, I believe, don't giving up of the things you wanted to do. That's number one thing. Because a lot of patients believe because they were diagnosed with MS, they get that label and life is over. Don't look at it like that. As I said at that last portion, look at it as a challenge, as an opportunity that you're going to overcome it. And no matter what it is, again, that's why I said, I wish we had like 3 hours so I can give you all that thing. But at the end of the day, the bottom line is not allowing this disease, however way or shape, to take over your life. I think that's healthy living. Balance exercise, balance life, balance relationships. But the things you always wanted to do, continue doing them. Don't let this disease stop you from traveling the world. Stop, especially these days, even people, this is a very short story. I have a group of 6 MS patients that they all met at the MS support group, 6 female MS patients. They're all in their 50s and 60s. 3 of them are on wheelchair because they had the disease for 40 years and they never started any medication. 2 of them use a walker and 2 of them are absolutely not using anything for walking. These 6 patients, before COVID, every year they traveled to a different part of the world. They would make accommodation for them, even for the wheelchair bound, to get on the plane, get off the plane. They went to Africa, they went to Asia, they went to other places. Why? Because they have not allowed MS to stop them from what they want to do. So in your big group of great people that you guys are take care of, it's the same thing. I think the most important part of it is having a balanced, healthy life, which combines everything that we talked about today. And the most important, not giving up on the things you wanted to do. Fight for it, get it done, and get help to get it done. I think those are the things that in the short time, it can help.
Good, thank you. Sagit, we have a question also from one of our members, I saw.
The one that you sent me, for some reason I can't open the group.
Yes, from Michal, but I sent you on WhatsApp.
Right. So Michal was asking, she was saying that some sports like weightlifting or even some specific things that she's doing in sport are increasing the level of spasm in the body. So whether you have any recommendation to do.
Right. So there are 2 things about exercise, which again, because we didn't get into detail of it, that is important. Number 1 is that when you're exercising, you got to make sure you know your limitations for the exercise. There are people who, let's say, they should be on a treadmill or bicycle for 10 minutes. And after 10 minutes, the body gets overheated. So one of the biggest negative things about MS, as you all know, is that when your body gets overheated, you're going to start having symptoms. It's not an MS attack, but it's the MS pseudo exacerbations or pseudo symptoms you get, because once you cool yourself down, the symptoms goes away most of the time. So number 1, when you're exercising, you do not want to push yourself too much, because that can cause more harm from the cellular standpoint. Spasticity that your questioner was asking about is a definition that when muscle gets contracted, as you're becoming more active, which is the early part of what we call spasticity. When you talk to your doctors, and if you're someone who has a lot of muscle tightness, you can talk to your respective neurologist, and there are medications that they can help you with reducing the spasticity. There are injections that can help, there are physical therapy that can help. But some of the patients who have mild to moderate muscle spasms, if they go beyond a certain amount of time of exercising, the muscle tells them, hey, I'm not gonna go anymore of this. I'm gonna get contracted, spastic, so that means you have to get off the bike. It's a signal of the body. So the example that I use for my patients for that, is that every car that you drive has a little light on the dashboard that when the engine doesn't work, that light comes on and tells you, hey, if you don't stop the car, the engine is going to shut down completely, or you're running out of gas. So you have to think about that spasticity as your check engine light that is telling you you've gone too far, stop and get off the bike, for example. But at the same time, you don't want to let that be the blockade. Talk to your neurologist, let them know you have spasticity, describe it to them. There are medications that they can give you in addition to your MS medication that can reduce that symptoms, which is very beneficial. So don't give up the exercise for that reason, but talk to the neurologist so they can help you.
Don't say why it happened to me, say what can I do? Go to the doctor and always get an answer. I think this is the most important thing you're saying. Don't stay with the pain, don't stay with the problem, just handle it. Thank you.
We have another question about fatigue, about exhaustion, about the exhaustion system. If I'm tired a lot of, and most of the time, even with drug or even with nutrition, what do we know about the tiring factor or the to be very, very tired if it's in the evening or if it's early in the morning?
So fatigue is probably is one of the most invisible, because it's not really visible to us to see. It's not like an MS lesion you can see. So fatigue is probably number one invisible symptoms of MS. Why? Because it's extremely difficult to evaluate. For example, if somebody says, I have muscle weakness, I can bring them to the exam room and I can examine their muscles. Fatigue is not visible in a sense that you have to believe what the patient tells you that they have. About almost 45 to 50% of MS patients overall have fatigue. Some of them, it has a minor fatigue that, you know, they get over it. They got up and they do a little stretching exercise. They activate their, you know, exercise mechanism in the body and it gets better. And there are some MS patients who, when they wake up in the morning, they're fatigued. In the middle of a day, they're fatigued. And when they go to bed, they're fatigued. That's what we call generalized fatigue, in a sense that they're not able to do things. A lot of times, as I said, I wonder whether there are other secondary element that comes into the picture. When somebody's under a lot of stress and has depression, and has psychological problem, fatigue is also trending because you're not in the mood of doing things and you hide behind the element of fatigue. But other than that, if it's a true fatigue, there are medications that are not FDA approved to be used in fatigue. However, if you talk to your neurologist, they know what they are. I cannot give a name of medications in here in this discussion, but there are medications that we have used, they're oral medication that we have given to the MS patients that they take while they have severe fatigue, and it boosts energy. But beside medication, which should be the last resort, we talked about multiple things during the past hour and something. Studies have shown when people don't exercise, fatigue gets worse. And then when you ask the patient, why aren't you exercising? They said, because I'm too tired, I'm too fatigued. It's a vicious cycle that comes into the picture. And the only way to break that cycle is to push yourself and go out and exercise. If you promise you, if you do it for 2-3 weeks by pushing yourself, then your body's gonna get used to it. Fatigue comes down and you realize by doing 30 minutes of exercise, for example, your level of fatigue has come down. Why is that? And that's one of the key things. We did a study at USC. We put 20 human beings on exercise machine, and we start drawing blood from them every half an hour to an hour. And we measured the concentration of dopamine and serotonin. These are the two neurotransmitters in the body that makes you happy and energetic. As these people exercise and they continue exercising, the concentration of these two neurotransmitters went up in their blood, which means you naturally produce enzymes in your body and neurotransmitters that can get better and better as you exercise. The example of it is when you go to the gym. When was the last time you went to the gym and you saw somebody who's every day in the gym, they're exercising and they look depressed? You never see somebody crying as they're on the treadmill. You don't ever see that. Why?
We see the dopamine. The dopamine is working.
Actually boost your mood, right? So there's a reality into it that you have to push yourself to break the cycle. I think that's probably would be the most important.
Good. Orit is asking about acupuncture. What do you think about it?
I am a very progressive physician. I'm sure there are like older neurologists that don't believe in acupuncture or Tai Chi or yoga or physical manipulation. I do believe acupuncture actually is very helpful. I have had a lot of patients, especially with either, let's say, pain in the portion of their body or the spasticity that we were talking about, the muscle spasm. I believe acupuncture can really help. And with acupuncture, you're not really need to put additional medication in your body and has been beneficial. So I'm a big believer of what I call complementary medicine. When I said at the beginning, acupuncture is one of those complementary medicine in addition to the MS medication. I believe it really helps.
Good. And Ilan is asking about drinking wine, like a glass of wine, a little bit of amount of wine, but what do you think about drinking wine? Is it problematic?
So in 1995, French scientists somehow, they all of a sudden discovered red wine can eradicate heart problem, which was not true actually, was it? So then they start publicizing that people should drink a lot of red wine. Now, moderation. I believe moderation. So drinking a little red wine it can be helpful for the cardiovascular system, but from the also immunological system. But when people go beyond that, and when I say little, maybe 1 or 2 glasses a week maximum. But if you're sitting and drinking hard whiskey or vodka or all the other things, no, those are not beneficial. A little red wine has been shown to improve cardiovascular functionality, which is good, and also can improve immune function. And again, that is very socially, very limited amount. But other than that, drinking 1 or 2 bottles of wine a night is not gonna help you, it's gonna harm you. You gotta be careful with that. Why? Because it's gonna affect your liver, and you need your liver to metabolize your MS medication and all the other medication that you are on. And if your liver stops functioning properly, your disease is gonna get worse. So for that reason, you definitely have to moderate alcohol consumption.
Good, thank you. And Sigal is asking about Feldenkrais, and Ronnie is asking, when are you coming back to Israel?
I am hoping, hopefully when the pandemic is over and we're allowed to travel, which hopefully would be end of this year or next year at some point, I definitely have to come and visit the family. I'm sorry, what was the first question that you had?
Feldenkrais, if you recommend it.
Say it again?
Feldenkrais.
Oh, Feldenkrais. The jury, we have a saying in the US, the jury is still out, which means that we don't really know whether it's beneficial or not in that part. So for that reason, we have not seen much of a benefit and we have not seen much of a harm from it. But there are some patients who tell me they benefited, so we don't have much of an opinion about it. The key thing about medicine and us as a doctor is that we're more worried about something causing harm to you guys. You know what I mean? We don't want something to damage your body or cause exacerbations of the symptoms. And if it's not, obviously you can try it and it might be beneficial to you.
Good. And Noga is asking, what do you think about stem cells transplant?
So that was one of the key things at the beginning when you asked me what are some of the innovative new things that is being worked on. So stem cell transplant are in the very early phases of research. And it's not a new thing. We have used a stem cell to treat a lot of other conditions in the past, but in MS and autoimmune disorders, we're also looking at using a stem cell to see if we can repair myelin and repair axon or nerves. Those are in the very preliminary stages. They're not ready for human being yet. Now, mind you, if you go on the internet and type a stem cell project, you might find places in Mexico or in Thailand or Taiwan that they offer stem cell. Those are false and those are fake. And I do not recommend anybody to go spend hundreds of thousands of dollars on going getting those because they have not worked. We have to be patient about that. We're not ready to put the stem cells in the human with MS yet, but I'm hoping over the next 5 to 6 years, we'll be able to use it as part of a treatment of repairing MS.
Good, thank you. And what do you think about the COVID-19 vaccine?
So generally speaking, which I knew that question was going to come up at some point, generally speaking, we believe, and I believe not just as a doctor, but as somebody who's an immunologist and a neurologist, that we all should be vaccinated. That's our belief. Now, I'm sure there are a lot of, even in the US, there are some people who are anti-vaccines and they always say the vaccine, this vaccine, that. But you gotta understand, this is different. This situation right now, in my opinion, is different than any other vaccination. Why? Because none of those diseases at the time, we had a capability of getting vaccine for it. If you look at polio, for example, which a lot of people, a lot of kids got affected with polio and they're walking with a limp and walking problem. Or if you're looking at conditions such as mumps, measles, rubella, which we vaccinate our kids for, at a time when those diseases or viruses came, millions of people died because there was nothing available to treat them. With COVID-19, we have had more than millions of people have died. In the United States, we just reached 500,000, 500,000 that died. In the entire world, more than 2.5 million people have died from this disease, which is a lot. In my opinion, as a physician, the only way we can go back to a normal life is to be vaccinated. So that is, again, I might be prejudiced about it because I'm a doctor, but as an MS doctors, I do encourage my patients to be vaccinated. So, and this is articles that we have published in National MS Society website in the US, and you guys can read that also, go to National MS Society. And the reason for it is not contraindicated for MS patients to get vaccinated. It doesn't affect their immune system. It does not, so far, we haven't seen any exacerbations of MS or having negative effect on MS, and they need to be protected. Why? Because MS patients, if they get COVID, the severity of the COVID has been shown. We have had more than almost 2,000 MS patients in the US that got COVID also, but we found out the severity of the COVID infection in MS patients are worse than general population. So they end up in the hospital more, they can die from it more. So for that reason, we recommend all MS patients to be vaccinated. One key thing about it is that when to get vaccinated, it depends on what MS medications you're on. So far, we believe all the medications that exist, disease-modifying therapies, the patient can continue on them. There's only 3 medications that you need to talk to your doctor to find out how long after receiving those medications you can get vaccine. One of them is Ocrevus, the other one is Kesimpta, and the other one is Lemtrada. These are the 3 medications that you definitely want to talk to your doctors or any other MS medications you're on. Discuss with your neurologist and find out what they recommend as far as you need to stop your medication or how long gap do you need. Most other medication like pills, Tecfidera, injectable medication, we don't believe there's need to be any stop of the medication. You can continue getting it while you're getting vaccination. And the only reason for those 3, because you want to make sure your immune system is not suppressed when you're getting the vaccine. Because if you get the vaccine when your immune system is suppressed, you're not going to get the benefits of the vaccine. You're not producing the antibodies. So for that reason, I strongly suggest, and please translate it to your people later on, that they definitely individually need to talk to their own doctors because each person has an individual situation and find out should they get it and when they can get it. I think, but as far as generally speaking, we believe in the vaccine that is going to hopefully get us out of this pandemic.
Good, thank you. And we have a group of parents that they have a teenager with MS that we support them also. You have young patients with MS. What do you know now after 20 years of research? What those parents need to know more than what we talk about, okay, in the last hour? Is there any recommendation that they need to know, they need to act through, they need to be aware of because they have young people?
So we have known MS not only affect adults, but as a matter of fact, it affects the pediatric or children population a lot. The youngest patient that I have had with MS has been 2 or 3 years old that was diagnosed with MS. But in the history book, the youngest patient that has been diagnosed with MS was only 6 months old, and she was diagnosed with MS. Pediatric MS is a little different when it comes to symptoms presentation. Unfortunately, studies have shown pediatric MS can have a little bit of a more aggressive presentation, which means that later on down the line, it can have a more aggressive disease. So for that reason, the biggest advice to the parents or the children with the MS is to get evaluated early, get diagnosed early, and start treatment early. This is very important because of the fact that when you're looking at teenagers, especially people who have gone through puberty, for example, you're going to see more presentation of MS in them because of the fact that the hormonal changes in their body, especially young women, the hormonal fluctuation in their body can give more symptoms to them. So a 13-year-old female who has already, gone through puberty, they have a very high concentration of the estrogen and progesterone in their body because their ovaries start producing. And over years, the studies have shown that's one of the reasons we have more women with MS than men, because the hormonal fluctuation that exists on the monthly cycle of female with MS. But generally speaking, what they need to know is to find a good neurologist, a pediatric neurologist, obviously, who's familiar with management of MS and start treatment early. One of the biggest problems is that the parents, they go through denial. Oh, no. He doesn't have MS or she doesn't have MS. And that gap that they put, even if it's a 2, 3, 4 years gap that they put by denying the diagnosis of MS, that is a very valuable time that this child could start treatment, could prevent them from having a bad MS when they become adult. So for that reason, do not ignore it. Don't deny it. If it's a formal diagnosis of MS, make sure they be seen by a specialist. And there are treatments available for them as well that, in my opinion, be true. So I do have pediatric MS cases, which are teenagers. And a lot of them, if they have an adult body size, adult body height and weight, every MS medication that we have could be work for them, but it depends. If they don't, there is a calculated different dose that we use in the pediatric population.
And the recommendation about nutrition and sport and
it applies. Everyone applies to the kids as well. No difference.
So the whole house can be with better nutrition and more sport together.
And learn about the disease. I think one of the biggest problems is the fact that because parents themselves don't have enough knowledge about MS, and the kids could be a little distracted, ignorant. They're not going to sit down and read books on MS, for example. They might try to play video game than anything else. So it's important for the entire family to get educated on it, especially the parents, so they can see the signs and symptoms in the kid, and they can help the kid, make the kid knowledgeable, make them exercise, make them eat well. So the parents, in my opinion, play a very important role in influencing the kids to do the right thing for their MS.
Well, thank you. I hope they will watch us, so they will hear it. They will hear you say it. And now we are very curious for the last part. What is the connection between you and our Rosie? So what is the connection, the family connection also? And what I would like, if it's okay also with Rosie, if you can remember, back the first day that you started to talk about MS between you two. And that before Rosie even got her diagnostics, and Rosie, I hope that you can tell us also, you can unmute you, and also tell us how was it in the beginning, and in the process, and being a family of Dr. Daniel, and you know, let us hear your story if it's okay from you.
Sure. When I became an MS doctor, which is almost 20 years ago, as you asked, one of the key things that I always was intrigued about, it was the immunology, about the disease itself, about the type of younger patients that you're going to be treating and all of those things. But I never thought, I always knew there's a reason that I became a doctor, but I didn't know why was it that I was shifted towards something like that, beside the fact that my own special interest. But you never know what is the reason that has been planned behind our life journey, for example. So, and again, Rosie can speak into that. So I was gonna throw something teasy or something about the fact that Rosie saw me in the movie theater in Israel and she stalked me and that kind of thing, but I'm not gonna do that.
She adopted you.
Nobody's gonna believe you. I'm too beautiful for that.
She basically was fascinated by this man that she saw in the movie theater. No, it's not about that. Fascinated, but not about that. But I think, so I am actually uncle of Rosie. Rosie is my niece. She's a daughter of my beloved sister. And I obviously—
I want to stop you there because you have to understand who Daniel Bandari is. When my mom was 26 years old in Iran, in Shiraz, she was diagnosed with breast cancer. I was 7 years old in Shiraz, and Daniel, my uncle and my grandma and my mom's family were in US, and my mom just gave birth to my brother. He was 6 months old. So Daniel Bandari, that is talking with us right now, did whatever he could in the world to bring my mom to US in the middle of Iran-Iraq war, and he did it. And when she came to US, it was not easy to get the visa, and he got the visa. It took him 6 months to be out of country to do that and beg, I don't know, whoever he could. And when she got to US, he did whatever he could, find like money and doctors, and we lost her. She was 29 years old, and we lost her in LA to breast cancer. And 5 years ago, 22nd of July, I called the only doctor I knew ever when I got to the hospital, and I couldn't see in my eye. And when I called you, I just told you what happened, and you just told me, I'm gonna call you later. And I got so pissed off, like, oh my God, I'm calling my uncle. How can he hang up? He doesn't remember my mom. Like, he's the only doctor. So it took him like 1 hour to call back. And his voice was, you know, I heard sadness in his voice. And he didn't say anything. He just gave me, like a good doctor, a list of tests, and I gave it to the doctor in Asaf HaRofeh. And when I got diagnosed after 7 days, it was Sunday, they told me I have MS. And the doctor in Asaf HaRofeh told me, the only thing you do, don't go into Google it, because don't believe what you read. And the only thing I did is I Googled it. And then I started crying. And this is the most important thing. I'm telling you my story because it's important for the people in house that are listening. And Daniel Bandari told me, I called him crying like hell. And I said, listen, I met the guy I want to get married the second time. I want to be happy. If I'm going to sit on a wheelchair, and if my life has ended now, just tell me. And he told me the most important sentence, and this is what I'm telling you guys. MS will not kill you. You will kill you. And this is what you told me. If you want to sit on a wheelchair, you will sit. If you don't want, you can do whatever you can. Don't ask why. Ask what I can do. And this is your sentence, Mr. Daniel Bandari. And he told me, you know what I do in life? I'm an MS specialist. And the next sentence I said is, why aren't you a doctor that gives birth to babies? Why are you an MS doctor?
So doctor, how was it when your life mission became a part of your family?
That changes you a little bit, and that puts things in a little perspective, in a sense that, as I said, up to that point, obviously you're a doctor of people, doctor of humanity, doctor for everyone, but then you realize that, you know, could that have been a divine intervention that somehow drove you to that? And, you know, I'm not extremely, you know, Hasidic Orthodox person, I'm an observant Jew, but at the same time, I believe that there are certain external element that comes and drives certain forces to do that. And I'm thinking, for example, in a situation like this, and let me put it this way before I carry on. I treat every one of my patients as they are my sisters, my daughters, my niece and granddaughter. It doesn't matter, whatever they are. But it's a little obviously different. And everybody would say that when it hits home, when it's one of your blood relative or something like that, does that make a huge difference? No, the advice that I give to Rosie, it's advice that I give to my patients, obviously. Am I harsher on her a lot of times because of the fact that sometimes she misbehaves herself and she doesn't do some of the thing? Absolutely, I am. And she knows, but overall, I have to say, over years that has passed, analyzing why and what are we on this earth for, I think it put a different perspective into it. Was it difficult? Yes, but not as difficult as if I wasn't a neurologist, for example. Because to me, at least I had those weapons in my hand that I could possibly help. And as a matter of fact, one of the key part of it was to collaborate with her doctors, for example, at Tel HaShomer, which I know quite a few of them, obviously, over years and be able to get work of nothing extra that other people could not get, but at least analyzing and explaining and being able to put her in perspective. Because one of the biggest reactions of human being, including her at the beginning, was that I'm not going to do anything about this thing. I'm going to get on the wheelchair. I'm going to do this. And I had to bring it down to earth and says, no, you're not going to do this. You're not going to do that. You are going to get treatment. You are going to do this. And that's what you're going to do. You have no choice because that's what you're going to do. And I think that probably gave her that confidence over time and that trust that she could do all of these things. She was able to achieve this. And I have seen that not just in Rosie, which is my niece, but in patients who are in that category. Was it difficult to understand? No, I still don't understand. I still don't understand why we have diseases in the world, obviously. We don't. Same as I don't understand why her mom was diagnosed with breast cancer, for example, unjustifiably. So, but at the end of the day, we want to believe that there's a higher purpose to everything. And we're hoping that there's a higher purpose, if there is a higher being to everything. And we just are players in that part. And we just continue the best way we can. And I have to say, I'm very proud of her because she did buckled up. She did come out of that little seizure of, denial into it and became the person who she is. And it has grown her a lot. It has matured her personality, being the person who she is, getting trained on her, special work that she's doing, even prior to doing, mastery in LLP and all of those help that she has done to people. I'm sure you guys know that she's done a very good job as far as being an advocate, doing all of those things. And I'm proud of her, what she has done. It is something that I believe is more justifiable now after 5 years than not. To me, it was a difficult thing, obviously, because again, the last thing you would want to have any family member or any friends with any kind of issue. But I believe me being an MS doctor had that help and that had benefit of being able to bring her down to earth, calm her down so she can handle her disease a little bit better. And even up to now, same as any human being, there are times that people go out of control. They hear a news and everything bursts off. And I still have to every once in a while, not as much as before, but every once in a while, we have to have a logical discussion on the phone with each other and put the analogy into it, calm her down and do the thing that she needs to do, which is no different than anybody else. And I have to say, that was one of the reasons that I mentioned at the beginning. It is important for MS patients to have a support network. And that support network not only could be the young man that they met and they want to get married, the child that they're going to have, the fact that they want to get pregnant during the MS. And she is a prime example of all of those blockades that can come toward the human being at the prime of your life that can easily derail you and take you to a completely different direction. And unless somebody push you back and bring you in to the right direction and tell you, hey, you can get married, you can have a child, you can have a daughter that you want, you can have a career, you're going to live a normal life. And no, you are not going to end up on a walker or wheelchair or anything like that. Why? Because you're going to be assertive and you're going to fight this thing with and no. And I think she's the prime example, same as I'm sure hundreds of people in your group are, and I'm proud of her.
You said before that when an MS patient become a mentor, this is like the higher level of awareness, and when he helps other people to be the best version of themselves. So it's like this is like Rosie as the perfect example, because what she does today. So she's the best example for what you said in the beginning of the interview when we started to talk about the mentor internship, and you talk about what is an MS patient when he become a mentor for other people.
Thank you.
That is a true element of elevation in the level of knowledge and personality. Once you become a teacher, once you become a mentor in any category, you have reached a different level that you can help other people. I believe it's one of the key things that she has been doing in Israel, helping couples and doing all the other things in the world. She's reaching that. And I'm very happy about it. And hopefully she will stop stalking me in movie theaters. So that's a famous story.
So you need to come to Israel for the cinema.
Our story is like an example that there is a bigger, huger thing in this world than all of us. It's like,
yes, it's like, like a question of the universe. Something, yes. Something that is bigger. This is why I wanted to do this conversation when Rosie like told me a year ago about her uncle. For a year, I started to think I will find the opportunity. I need to bring them together for the community. And also, Sagit, thank you very much for being us today. And Rosie, amazing Rosie, thank you very much for being us and telling your own private story. And Dr. Daniel Bandari, thank you very much from the MS Home Association and from Irit Luzon, the CEO. And thank you from all of the community, the people that will watch this, they will watch today and tomorrow. And
I love you. And I miss you, and I hope to see you soon in Israel. And people are asking in the chat, when are you coming to Israel? So we all want to see you now. It's not me, it's 2,200 people waiting for you now.
I appreciate that. It's number one, my pleasure to all of you. Thanks for having me. It's always an honor and a pleasure to be able to help or educate, because I learn when I talk and when I teach. So again, thanks for having me. It's my pleasure. Hopefully when things calm down and this pandemic is behind us, obviously that would be one of the first places that we're gonna definitely visit. In the meantime, again, my hats off to all of you. Congratulations to all of you for having such a vast and being able to reach more than 2,000 MS patients and helping them out. Keep doing what you're doing, okay? Stay strong, and we'll get past this pandemic thing and hopefully life get back to normal. Thank you, guys.
Thank you.
My pleasure.
Thank you.
Love you. Thank you, Anna. Thank you, Sagit.
Good night from Israel.
Same here. Good night, guys.
Bye.